Record. Welcome everyone. Today we have Kirsten Trudeau, one of the nurse practitioners that works within the Kentucky Infection Prevention Training Center, presenting to us today about infection prevention and control through the ages. So Kirsten, take it away.
Perfect. Thank you. All right. So today we're going to talk about infection prevention and control through the ages. So this is an interesting journey from medieval times all the way through present day. So we will get started. So funding for this presentation was provided by the Kentucky Department for Public Health. Content includes discussion of unlabeled use of products. I have no financial interests or other relationships with any manufacturers of products, and no commercial support was provided for this activity. So our objectives today, we will recall significant infectious disease outbreaks that influence changes in infection prevention and control practices. We'll describe how IPC measures have evolved from ancient practices to modern evidence-based guidelines. We'll identify some key historical figures and their contributions to infection prevention and control. We'll analyze how the emergence of antibiotic resistance and opportunistic pathogens have shifted those IPC priorities over time. And then we'll compare and contrast IPC approaches from different historic eras. So how did we get here? You can see the picture on the left here. This was essentially instruction for how to perform an amputation. And then we get to a more exact science and exact medicine here on the right. So we'll kind of take a journey through, what practices looked like from an infection prevention standpoint when they were doing things sort of it, how you might say not in a sterile manner, especially with like amputations and surgeries, and then how we got to more of an exact, precise medicine that we have today. So we'll start with a time period between 430 BCE and 1400 AD when we'll look at kind of the Western classic medicine. So this was really the age of the plagues. So there were multiple plagues during this era. We had the plague of Athens, the Antonine plague, the plague of Cyprian, the plague of Justinian, the Roman plague, Near East plagues, and then of course the Black Death. And so Erasmus had a quote during this time, and he said essentially that filth was a fact. So during the time period, it wasn't that people were filthy by choice, it just was a fact. It was how people lived. So the floors in general are laid with white clay and covered with rushes, occasionally renewed, but so imperfectly that the bottom layer is left undisturbed, sometimes for 20 years, harboring expectoration, vomiting, the leakage of dogs and men, ale droppings, scraps of fish, and other abominations not fit to be mentioned. So you can see here that it's not that people were making a necessary choice to live this way, but it's just how things were. And I don't think that they really knew much different. So the plague of Athens between 1429 and 426 BCE, this occurred during the Peloponnesian War. It originated just south of Ethiopia. It entered Athens through the port of Piraeus. It killed about 1/3 of the population, and it is still difficult to discern what caused this plague even 2,500 years later. There are many researchers over the years that have tried to figure out and determine what the cause of this plague was. Many have thought measles, typhus, ergotoxin, glanders, smallpox, but no one has really definitively determined what caused this particular plague. Now, the plague of Athens, it was accounted by Thucydides. He was the author of the history of the Peloponnesian. And so this was a book he was writing kind of on the account of the Peloponnesian War, but he paused his account on this to detail this disease that was occurring. And thankful for this really great account of this disease, that's how people are able to kind of look back and determine what was the cause. It was very detailed, but with so much detail, they really haven't been able to pinpoint which one. But some of the things that he had in his account were intense fever. These people did not want their skin touched. They truly just preferred to be submerged in cold water. They had an unceasing thirst. They were very restless. And they usually died in 7 to 9 days, having ulcerations and diarrhea. Now, the Black Death occurred in 1347 to 1351. About 25 million people died. It was caused by Yersinia pestis, and it was so infected rodents were bit by fleas, and then infected fleas were then transmitted to humans. So it originated in China, and really, this is, if you think about this, this is kind of like the birth of bioterrorism. So they use this to decimate. So the Mongol army used this to dissipate the Kipchak Khan Jenabeg army at the Genoese trading port of Kaffa. So they used these trebuchets to throw plague-infested corpses in the area to infect the enemy. And then the Genoese ships spread the disease west. Some of the symptoms of this were suddenly febrile with chills. They had painful abdomen and extremities, headaches, lymphadenopathy, and then these buboes that leaked pus. So some infection control and treatment methods at the time. So some things they were doing, whether it be to treat someone who was already ill or just prevent themselves from getting sick, were bathing in rose water and vinegar. And if they didn't have that, they were using personal urine as an alternative. They would drink pus from those leaking sites. They would put live hens near the swelling of the leaking sites. They would have they would drink human urine twice a day. They would also grind up emeralds and put that into wine and drink it. They also made this little warm beer tincture of roasted shells, marigold flowers, and treacle, and they drank that twice a day. So another method of infection control at the time, this was a picture, an image that you've probably seen before, but these were plague doctors. And these plague doctors were assigned to specific patients. So they knew at the time that these providers, these doctors were likely going to become ill from these patients. So they kind of sectioned off certain doctors to these patients. And so the PPE that was used, they used these long waxed coats or gowns. Their leggings were connected to their boots. They had gloves, a hat, a beaked mask, glass or crystal spectacles, a wand or a staff that they used to prevent from having to actually touch the patient. And then another thing that they did was they started quarantining these patients for 40 days. So if you think about it, this PPE looks funny, but it's not unlike a lot of the things that we use today. And then the quarantine, we also, isolate patients away from others. We have experienced quarantine. So again, not unlike some of the practices that we see today. So then we move on to the 16th to 18th century when we kind of move into that traditional Western medicine. So some epidemics during this time, smallpox, malaria, dysentery, yellow fever, diphtheria, and scarlet fever, respiratory diseases like whooping cough, mumps, measles, typhus, and typhoid fever. And really, this was a time period where we had such growth when it comes to learning about microorganisms. So we had the discovery of microorganisms at this time, and we had many significant people during this time period. So Antony van Leeuwenhoek, he designed the microscope. And then Robert Hooke used a microscope and discovered living things underneath this microscope. And then Lazzaro Spallanzani, he sterilized broth. So he found that if he sterilized broth, if he boiled broth, that he could then free it of any microorganisms. And then Louis Pasteur used that concept, and he showed that if you took this sterilized broth, but then exposed it to the environment, that set of exposed broth then grew more microbes, whereas the one that was not exposed stayed sterile. So using this thought process, he debunked that thought of spontaneous generation of microbes, that something had to be exposed to that contamination. Then you had Ferdinand Julius Kahn. He is responsible for the bacterial shape classification. And then Robert Koch, he showed that microbes cause disease, and he discovered this in his cows who had anthrax, and he was able to transmit that disease to other cows via blood samples. So infection control methods during this time, this is when we saw the first clinical trial for smallpox vaccination. The first health department was developed. The first municipal water system was created. Quarantine was used for those suspected plague patients. They had cleaning servants to test the linens. So if someone died from the plague and they had slept on certain linens, they would launder the linens, but then they would have cleaning servants to sleep on these linens. And if they didn't get sick, then they were deemed fine for others to use. But of course, if they did, then the linens had to be destroyed. They also did vinegar washes, and then they knew that their mail may be a risk of contamination and transferring these illnesses. So they exposed their mail to burning sulfur to try to prevent that exposure as well. So some areas of opportunity, I'll call it, some things that, an infection preventionist might really focus their efforts on today, were surgery. So surgery was certainly not as delicate of an operation as it is today. So they performed surgeries in operating theaters. And these surgeries were often performed by these strolling barber surgeons. So they were barbers by trade, and then they also performed surgeries. So they kind of did both, and there wasn't a lot of hygiene in between. So they wore these surgery overcoats that were not changed between surgeries. They often had, like pus and blood. Um, essentially just pieces of body parts on the surgery overcoats. They were worn for every surgery. They were using instruments that were not sterilized between, so the instruments were contaminated. And you can see over on the right here, this is a picture that a strolling barber used and just kind of carried around for bloodletting. And so at the time, you can imagine these probably were not the most cleanly of things. And then they also used sawdust on operating room floors, similar to the butcher shop that was likely right down the street. They used sawdust to soak up blood and bodily excretions on the floor. Then we moved to the 19th century with early modern medicine. Some common diseases during the 19th century were smallpox, typhoid fever, dysentery, malaria, yellow fever, measles, and tuberculosis. So tuberculosis, we'll highlight this one here. Now, this is ancient in origin. It is nearly 70,000 years old. But during the 19th century, we really saw a big epidemic. So the robber of youth, white plague, captain of all these men's death, those were all names for tuberculosis. So from 17th to 19th century, we started to really learn more about the infectious disease properties thanks to Robert Koch and his germ theory of 1882. But when tuberculosis really became a big deal, we started to identify risks. So during the Industrial Revolution, we found that you were more at risk for tuberculosis when you had areas of poor ventilation and overcrowding. And that's not unlike some of the risks that we see today. And then in the 1850s, sanatorium cure debuted. And so that was where these patients were sent to sanatoriums. And you can see here on the right, this is a very well known sanatorium, Waverly Hills, right here in Louisville. So these patients were sent to different sanatoriums to get fresh air, good nutrition, and that was thought to improve their condition. But subsequently, that kind of isolated these patients to rural areas, which cut down on the transmission of this illness to the public. During this time period, some historic figures, we had Ignaz Semmelweis. He's the father of hand hygiene. He did subscribe to the germ theory of disease, and because of that, he was able to solve the mystery of childbed fever. So he was a doctor, and he delivered babies, and so he determined that many mothers, after delivering a baby, would have childbed fever, and many of them would die. And it wasn't happening with the midwives. So he could not, determine why with the medical doctors there were more deaths, but with the midwives there weren't. And then what it boiled down to was that the medical doctors were performing autopsies, and then they were going straight to deliveries. And they weren't washing their hands in between, but the midwives, they did not perform autopsies. So their infection rates were lower. They were not having these many cases of childbed fever followed by death, whereas the doctors were. So he implemented a hand washing protocol for them at the time where they had to wash their hands after these autopsies before they delivered the babies. And he saw a dramatic decrease in these cases of childbed fever when he implemented this. Then we have John Snow. He's considered to be the father of epidemiology. He was an obstetrician and anesthesiologist. So he traced the outbreak of the London cholera epidemic to a water pump. This occurred in 1854. This was the Broad Street water pump. And so this was really one of the first times where you were able to map out a disease and see the cases on a map and then correlate it back to a source. And so because of that, John Snow has really contributed a lot to the founding of epidemiology. Um, and you can see here the water pump is actually still there. It has been moved a couple streets over to where John Snow lived, but that is the water pump. Then, of course, we can't talk about the history of any part of nursing without talking about Florence Nightingale. So we had the founder of modern nursing. So she cared for soldiers during the Crimean War between 1853 and 1856. She was known as the Lady with the Lamp. So she wrote the book Notes on Nursing in 1960, and in this book she highlighted the importance of fundamental practices of nursing. And some of those that she wrote about were hand washing, good hygiene practices, recommendations for sanitation of the hospital environment to prevent that cross infection. And this is really one of the first times that we saw recommendations for this written out. And then she also supported good ventilation. Her recommendation for that was to perform an air test, which generally speaking was just a smelling of the air. If it smelled bad, then it wasn't good ventilation. If it smelled good, then it was. Obviously, this is not the case today, but she did put a lot of effort into supporting good ventilation. She did say that nurses were 3 times more likely to die of infectious diseases than a person of the general public. But it wasn't until the 1980s until Nightingale actually subscribed to the idea that diseases were caused by specific microorganisms. So then you have Eliza Jane Lillington. So this is just really interesting. She was a nursing student during this time period. So when you had people like Florence Nightingale making their recommendations and then teaching nurses how to care for patients, this was a note that she actually took from one of her nursing classes. So this was in 1987. Her school notes said, rules to be observed in the management of epidemics or contagious diseases, more specifically for private nurses. First, the patient should be at once separated from all other inmates of the house, leaving the room devoted to him and his attendant. Second, all beds, curtains, hanging carpets, articles of dress and wardrobes, and all unnecessary furniture be removed. Third, well-ventilated windows partly open at the top chimney, free of weather, or a size of room to permit a fire burning. The floor to be sprinkled daily with disinfectant fluid and thoroughly cleaned. Fourth, the door should be kept closed and a wet sheet of solution of carbolic acid chloride of lime or condy of fluid hung. So again, as we move through time, you can see that these things are not unlike the things that we do today. So it's just interesting to see, in 1887, we knew some of these things were important. And so it's interesting how things have evolved and then some things have stayed consistent over time. And then in 1980, between 1900 and 1980, we move into late modern medicine. So the Spanish flu, this occurred in 1918 to 1920. So it was caused by the influenza virus. Nearly 500 million people were infected. About 700,000 people died in the US, and the life expectancy actually decreased by 12 years, and there was no vaccine. So I know a lot of you are probably thinking, like flashbacks to COVID. You have people, these are secretaries just working in an office and they're all wearing masks. You have the ladies at the Red Cross and they're making masks for the public. So it's interesting to see something that happened 100 years ago. Some of the same things were done during the COVID pandemic in an effort to prevent the spread. Some of the precautions against influenza, this was an actual publication that was used to encourage precautions. So influenza is spread through the discharge from eyes, nose, and mouth. Avoid persons with coughs and colds. If obliged to cough or sneeze yourself, when near another person, turn the face or cover the mouth and nose with a handkerchief. And such handkerchief should afterwards be sterilized by boiling or be destroyed. Avoid common drinking cups. Do not expectorate promiscuously. Do not stand close to another person while conversing, and do not talk directly at them. Discharges from the mouth are disseminated by talking. Avoid poorly ventilated rooms and see that living and sleeping quarters are well ventilated. Avoid crowds, especially within doors. Spend as much time as possible in the open, especially in the sunshine, and dress warmly to avoid wet feet and keep regular hours. So it's interesting that these precautions are things we're still kind of harping on today. And some people still, don't quite understand this. Of course, some of this, like, avoiding wet feet, are not as applicable today. But you can tell that there are many things that we are still doing. So public health after World War II, the Center for Disease Control and Prevention, or the CDC, was founded in 1946. At this time, they were doing mobile x-rays to screen for TB cases. The Hospital Survey and Construction Act of 1946, or the Hill-Burton Act, was released. And so this supported guidelines for cleaning of ORs, standard surgical attire, boiling of catheters, gloves, and needles for reuse. And they were ironing gauze for reuse. And so this was a time period where we started to see staphylococcal epidemics. This was found in the nasal and dermal carriers. This is when we started to see some penicillin resistance on the rise. And interestingly, this is when we got the first infection control nurse in the 1940s, and it was for epidemiological purposes. We also determined that healthcare workers were at high risk for TB because of high conversion rates. When we had new nurses and other healthcare workers going through training to a year into practice, they had high conversion rates, so they knew that they were at higher risk. So this time period is when we started to see the opportunistic pathogens or organisms. So from 1950 to 1960, there was a shift from hospital infections that were caused by SRS to the problematic gram-negative bacteria that we still have issues with today. So we have, some E. coli, Klebsiella, Proteus, Pseudomonas. So the concerns were antibiotic and disinfectant resistance, the survival of these organisms in adverse conditions, and they are prone to colonization. So by the 1960s, we had broad spectrum antibiotics that led to highly resistant Pseudomonas. And then soon after, Serratia and Acinetobacter developed resistant properties. So the 1880s to present, this was more of a shift to exact medicine. So we had the AIDS epidemic here. The first case presented in 1981. And in March of 1983, the CDC MMWR suggested that AIDS transmission might occur sexually by blood exposure or via blood products. So the recommendations were for prevention were issued by guidelines. So it was the guideline for isolation precautions in hospitals, and it contained a section on blood and bodily fluids. And then in August of 1987, the CDC then published recommendations for the prevention of HIV transmission in healthcare settings. In 1988, Ryan White, who testified about the stigma of AIDS and the lack of education. And if you don't know about Ryan White, he was a 13-year-old who had hemophilia, and he contracted AIDS from a blood transfusion. And unfortunately, he did die about 5 years after his diagnosis. But he and his mom really rallied for him to be able to return to school. But the lack of education about how AIDS is spread, there was really a lot of stigma about him returning to school. And he and his mom really rallied for that education so that people with HIV and AIDS were not mistreated due to lack of understanding. Then in June of 1988, the CDC published the Universal Blood and Body Fluid Precautions, also known as universal precautions. And under those precautions, blood and certain bodily fluids from all patients are considered potentially infectious for HIV, hepatitis B, and other bloodborne pathogens. Then we have COVID-19. I won't go too deep in this as we all lived through it. So, but you know that in March of 2020, there were shutdowns to prevent the spread of COVID-19. In March of 2020, we also had clinical trials that began on a vaccine. In April of 2020, social distancing measures still continued. There were recommendations for everyone to wear a mask outside of the home. And we also started to see some PPE shortages at this time. And then by October of 2020, they updated that guidance to include airborne transmission. And it is interesting at this time when this pathogen emerged. This is when the naming of these pathogens kind of changed. So instead of calling it the Spanish flu, like they did in 1918, when you really didn't know anything about the time period that caused it, that it was caused during. Now they call it COVID-19, where they've named the pathogen and the year that it surfaced. And then we have novel pathogens. So just to know that with novel pathogens during the COVID pandemic, our understanding of the disease changed. And we saw that the way we utilize PPE changed as we learned more about the disease. So just know that novel pathogens may emerge and how you have to use, not how you have to use PPE, but what PPE you use for that pathogen might evolve as you learn more about it. Specifically Ebola, there's a high level of PPE use because that risk of transmission is so high. And then artificial intelligence, infection prevention. This is, our present day. So there's a lot of use of artificial intelligence. When using it for IPC purposes, it has the ability to forecast infectious diseases. There's early warning signs. It can project the spread and identify high-risk areas. It helps with efficiency. So we saw this during COVID-19 when looking at chest x-rays. There is the ability to do disease screening with great sensitivity. It can help with resource management. There's also the ability to use chatbots for information dissemination. But with that comes great responsibility. So there are many ethical and safety concerns that have been raised about the use of artificial intelligence, as I'm sure you have all, heard about when it comes to healthcare. But of course, there's concerns for patient privacy, the concern for bias, and then the misinformation spread. So kind of counteracting, the chatbots for information dissemination, but we have to make sure that they are trained to give the correct information so we're not misinforming people. And that is all I have for you all today. I will open it up for questions.
Any questions for Kirsten? I always do think it's fascinating, the handwritten list of infection prevention opportunities that people can have and how truly close they correlate to what we do today. All right. If there are no questions, then we will sign off and see everyone next month. Thank you very much.